bad blood. So we call it a left to right shift. Once again it will produce a very high pressure left to right shunt, means the good blood is mixing with the bad blood, and as a result of this shift or flow of the blood continuously from the aorta to the pulmonary artery, you get a continuous machinery murmur, which is an important point for the diagnosis of the patent ductus arteriosus. And as a result of this thing, the lungs once again will get more blood, and it would develop a pulmonary hypertension. And when you get a pulmonary hypertension, ultimately it is giving more pressure to the right ventricle, and you get a right ventricular hypertrophy and reversal of shunt, again what we call as a Eisenmenger complex. And how do you know clinically? The patient will turn blue, and when the patient is becoming cyanotic, you can call the patient is now having a pulmonary hypertension, or the patient is going to develop a right ventricular hypertrophy. So if the right ventricular hypertrophy present for a long time, ultimately it fails the heart and we get a congestive heart failure. So the key point of our discussion today, to remember the incidence of congenital heart disease, that is about 1%. The most common type of congenital heart disease, that is a ventricular septal defect, which is about 42%. And the familial heart disease, which is a tetralogy of Fallot. And we have also discussed 3 different types of left to right shunt producing congenital heart disease, that is ASD, atrial septal defect, ventricular septal defect, and PDA. Why should we call it a left to right shunt? Because here the blood, which is good blood, has a high oxygen content, it mixing with the blood which has a low oxygen content in the right chamber of the heart. So when this scenario occurs, you have to also know that it is sending more blood to the lungs, which means the lung is now has to accept more blood, and that is causing a pulmonary hypertension. So all left to right shunt congenital heart disease would produce a pulmonary hypertension, and that in turn would produce a right ventricular hypertrophy and right heart failure. So when this patient would born, they will born like a normal kid, pink in color. You would like to cuddle them, but after some time, as soon as they develop this complex, the patient will turn blue. And please remember, this is an important feature. These are the important feature of the ASD, VSD and PDA. ASD and VSD, you can hear a systolic murmur. ASD murmur is not very prominent, but VSD murmur is prominent, which is a systolic murmur, hollow systolic murmur and a pansystolic murmur as well. But the patent ductus arteriosus, you get a murmur because of the continuous flow of the blood from the aorta to the pulmonary artery, and this is like a machinery murmur, continuously present. You do not separate this murmur as a murmur which is diastolic or systolic. It is continuously present, a blowing murmur in the chest. So this is what we have to study, the first part. The next part we are going to discuss about a congenital heart disease, that is a right to left shunt. Okay, one more thing I forgot to tell you, that we must remember the various associations of the other diseases with a congenital heart disease, that is the Down syndrome, Turner syndromes, altitude and the family. Now familial congenital heart disease is one, you can see it here, that is a tetralogy of Fallot. So tetralogy of the Fallot is the commonest type of right to left shunt containing congenital heart disease. Okay, up to this much today. We will see you later. Bye.